Hello, Patty. Just give us a minute. Perfect timing.
Hey, Olivia, how are you doing?
Hello, good. How are you
Excellent.
doing?
Quite well. That worked out quite nicely.
Hey, good timing, right?
Yeah, really good timing. Um, well, let's get started, and I'm really glad to have you here.
Well,
Anyway,
thank you so much for having me.
my pleasure. My name's still John. I'm Dr. Sarnoff from Premier Pediatrics. And at Premier, we've started a program over the last few years called the First Month to help people transition from um, pregnancy to parenthood. And the main parts of it are primarily we have in-house breastfeeding services, lactation, that's included in all of the well care. And we've partnered with a psychologist and the social workers who really help us to help parents with the emotional transition. So we are able to set up appointments both in our office and online just to help people to have some time to talk about what they've been going through, if they've been experiencing any postpartum, either anxiety or depression, or just if they want to talk about the highs and lows of the early days. Then the other part of it is we have a wonderful community contributors who are helping us both in terms of allowing us to have people to refer to and to do excellent talks just like the one we're about to do. So with that, I'd like to introduce Olivia. Is it Bergeron? Did I pronounce it correctly?
Bergeron. Yep.
Bergeron,
Yep.
yep. She started Mommy Groove, and make sure I'm pronouncing everything correctly. And she's a wonderful resource. And I've asked her to come here to talk to us about how to kind of prepare during the latter parts of pregnancy for the first part of parenthood. We often get that question during the prenatal visit, and I would thought it'd be wonderful to have someone to kind of go over that. So Olivia, without further ado, I welcome.
Well, thank you so much again for having me. It's a real pleasure to be here. And I really appreciate the support that you provide for parents, just because it's so necessary, particularly right now.
Yeah, exactly.
I mean, goodness, having a child is hard enough, and doing it during a pandemic
Mm,
when you don't have that access to support, you don't have access, you're not able just to see people, or you don't feel comfortable like going about your daily activities like one would normally do. It's a lot on parents right now, so there's a
yeah,
lot of stressors
I would think of it's just
inherent.
the isolation that you
Yeah,
feel regardless of where you are in life. But I can only imagine how difficult it is
right.
for new parents and that challenge.
Of
Um,
course, and as I'm sure you've heard, even before the pandemic, parents would often report to me just this pervasive feeling of isolation, not to mention overwhelm
mhm,
and guilt
mm,
about just kind of you name it. But I think that now that there's a pandemic in place and people don't have access to the levels of support that they might have had, just months ago, it's particularly difficult.
mhm.
And I'm sure you're hearing from a lot of parents, this isn't how it was supposed to be.
Yeah, exactly,
This
exactly.
is not what I planned for. This is not how I heard it would be. Lo and behold, it's here we are. So how do you help parents going through this? I mean, I think that the support that you're providing is fantastic. But as you might imagine, I think just the stressors inherent in the situation,
Yeah, yeah.
coupled with financial stressors, coupled with,
Mhm.
as you mentioned, isolation, overwhelm, guilt. These are all, like I
Mm.
said, those are all the things that I think that seem to be coming up quite a bit with
Yeah,
the parents
absolutely.
that I've been working with.
Well, let's, for the sake of this
So,
conversation, I think a good way to do it is let's break it down to just what in general you would tell parents in any period to get them prepared for these early days of parenthood, and then on the end, let's kind of superimpose how things are different now with the environment we find ourselves in. So I'm curious
okay.
when we get that question from people in the third trimester, what should we do? What would your answer to that be?
I would say cope ahead.
Yeah.
That's my, interface. I think it's much easier to line up support
Mm,
during pregnancy than when you are, managing an infant when you haven't slept, when the baby isn't sleeping very well.
hmm.
You're stressed out. You're kind of just trying to figure things out. Line up as much support as you can get in advance. You don't necessarily need to, take advantage of it, but if you know it's there, if you have all the information lined up, if the email addresses and the phone numbers, or even if you've made contacts with professionals out there that you
Hmm.
can reach out to if you need to. Hopefully you won't, but if you do need to, you have it all lined up. You don't need to worry about it.
Mm.
So that's
What?
one piece of advice if
Yeah.
folks are coming to you.
Oh, no, I'm sorry. Go ahead. Yeah. What
No,
type
so
of
I think
support would you do?
and there's a whole, yeah, there's a whole range of support that's out there, and maybe starting with, just postpartum care. Again, previously, I would direct people towards postpartum doulas or baby nurses are another option. Do people know the difference between the two of them? Obviously, right now, that's more complicated, a decision to make. I think some folks don't want anybody else coming into their homes, like understandably. So, how do you make that decision to either use that level of support or to forego that? Obviously, family support too. You can have family come and lend a hand, if you're comfortable, if you feel like the level of safety is adequate. But yeah, I mean, postpartum doulas, I think, are really well worth looking into. And those folks, just to distinguish between, doulas and baby nurses aren't actually nurses. They come in and they provide assistance in the evenings and at nighttime, basically taking care of the baby. Whereas a postpartum doula will come in and has a more global sense of taking care of the whole family, and can kind of, teach and educate families about, childcare. Do some shopping, light housekeeping. So their roles are slightly different. So knowing the difference between the two of them, I think, is handy. Other support to have lined up in advance, I would say, if you're planning to breastfeed, reaching out to some folks about breastfeeding support. I think for many people, it's a lot more difficult than they would have anticipated, unfortunately. And I think that too, when your expectation is, on one side and the reality is way on the other side, people tend to hit a wall, and it creates a lot of anxiety. This is supposed to be natural. I just be able to, feed a baby. This is what everybody else does. No one else is having a hard time of it. What's wrong with me? So, if you are having difficulty, and I understand you have breastfeeding support at Premier Pediatrics, which I think is fantastic and well worth checking out. There are other groups such as La Leche League that offer free support meetings. I would imagine right now they're probably virtual online. At least I would hope. But their website is lli.org, so you can check out local meetings wherever you are. But there are also lactation consultants and support that can come to your home, like IBCLCs. These are different levels of lactation counselors, the different levels of training.
What are the different levels?
So it's IBCLC is International Board Certified Lactation Consultant, I believe. And those folks have the most level of training. They literally have hundreds of hours of training to become a lactation counselor or consultant. The other levels have they're still trained, but a lesser degree of training. And so just knowing the difference between what level of support you need, and sometimes you don't need necessarily the top of the top to come in and check if you're not having major complications. But I think it behooves people to know what exactly they're getting when they have somebody that's helping them. And a lot of the lactation help right now is virtual. So people are kind of using their phones to kind of and FaceTime to get the help they need.
Is that something you'd set up before the baby is born, or is that usually something you feel like is something that when the problem arises or when you wanted to encounter?
Well, that's why I think it's important to have reached out to folks, if possible, ahead of time, just to know who you can call if you do run into a problem. Because if you're trying to feed a baby in the early days and you're having a hard time, and that can be a real, you're recovering physically, you're trying to manage pretty little sleep, and if you throw breastfeeding issues on top of it, where your child isn't either getting enough or they don't seem to be gaining enough weight quickly enough, I think that adds a whole layer of stress and anxiety, which I see time and again, unfortunately, just gets in the way. So if you're asking, should they line up these appointments ahead of time? It's a judgment call, I would say, but I don't think it's a bad thing to have some help come in that first week when baby's home, just to have somebody kind of eyeball you. My experience, both personally and professionally, is that the lactation help at hospitals tends to be cursory at best. So those folks, they tend to come in, peek on you, how you doing, okay, and then they take off. I mean, they have tons of clients to get in, patients to get in and see. So they're not often able to take the time if there are issues or lots of questions. So it might benefit people to have that, at least maybe a session lined up so someone can come and check out, make sure everything's going smoothly. So that that would be my advice. But obviously, in the moment, if you are having a hard time, you can still reach out for help. It's just easier to know who to call as opposed to be kind of in panic mode and trying to find, who do I call, when you're that level of stressed out.
Yeah, I feel like the preparation in and of itself, even if you don't need to use it, it helps to settle you because you're entering the great unknown. It's nice to control as much as you want to, or
Well,
as much as you can.
and New York City parents like to be in control.
Yeah.
We're pretty hard charging, right? Pretty type A personalities, a lot of folks. And so we like to lock things down and I think that's certainly part of it. It can ease some of the anxiety if you know, okay, if things do go sideways, I know what to do about it. I know who to call and how to handle this. Knowing that, I mean, these people oftentimes, if they're parents for the first time, anything you do for the first time, you're not an expert at first.
Mm-hmm.
And if that creates a real level of anxiety for parents, as I'm sure you see this as well, where people feel like, well, I should just know what to do. I should just know how to handle this. This is supposed to be somehow, innate knowledge that I just have. And oftentimes that's just right. When people need to be taught things, that there's a learning curve, and being okay with that, I think, is important.
Yeah, I mean, I think for me, I two things I always like to tell people is, the first thing is that even though there is a lot of planning to do, it's a very intimate and unique time when you're still a family of two.
Sure.
So I always tell parents, as much as you should plan, you should also find those nights to get the Netflix, watch the Netflix videos, and just kind of celebrate and enjoy, be mindful of the moment, understanding that when the baby is born, as wonderful as that's going to be, it's a whole new experience. So it's going to be intimate in a different way. So I always want to make sure people don't lose sight of it's a special time to enjoy in the moment, not just a time to plan for the next stage of life. So I think that's just an important reminder for parents. And then the second thing is the idea of, like you're suggesting, to be flexible in the sense that understanding that it may not go exactly how you anticipated, but
I can pretty much guarantee it will not.
Exactly. But in and of itself, that's kind of the beauty of life, is figuring that stuff out.
Well, it's right. I think it's about, letting go of control in order to regain a sense of control. You know what I mean? And being able to kind of, just to roll with things, and to know that, okay, if I don't have this need to kind of, get rigid about things, it has to be done a certain way, otherwise it's done wrong. And my party line is that, you can parent in a million different ways, and you can do, if the goal is a healthy, happy child, that can take many, many different paths.
That's such a great point, because so many times you hear from another person how they did it, and then you assume that was the right way to do it, when in fact that might be one of 100 right ways to do it. I think that's such a great point that parents need to keep in mind, that your way may be different, but it doesn't mean, but there are many different ways to do it.
Very sensitive at this time of comparison. They want to find the right way to do it. And if they feel that, somehow they're doing it wrong, which, what does that mean? Then they feel a lot of guilt and a lot of shame, and a sense of, they're letting their baby down already. And that's a pretty horrible feeling to sit with.
Yeah. How about the support of other people? Like, their mommy groups. Is that something that people tend to line up beforehand, or is that something?
Well, it depends. I've seen both. Some people, again, they want to kind of do their research in advance, which is probably easier to do, again, before you have a baby in your arms. But I think, the first weeks, maybe even months, you're probably not in a headspace to do a lot of networking necessarily. I mean, some people are, don't get me wrong, but I think a lot of people just feel like they just need to kind of nest and look internally and kind of get their bearings before they reach out for help outside. That being said, I think particularly becoming aware of, each neighborhood in Brooklyn has a, a Facebook group for parents, pretty much, if not a groups.io group. So I think it's handy to have people look outside and see what's out there in the community, and then to join those groups. And you don't necessarily need to post, but just keeping an eye on what's going on in the community of parents can help. Really, I mean, we discussed or mentioned isolation. That's at least a way to feel that they're connected to the community in their neighborhoods. The larger parenting community, and people at this stage of life, they're really reaching out for connection. Because it is so isolating, particularly, and I'm sure you see this, John, going into winter.
Yeah. Yep. Yep.
It's a long, dark season, and going out to the parks and playgrounds might not be such an appealing option. And so at least having some connection with other parents, either online, Zoom groups or Facebook groups, or finding ways to reach out and connect, I think it's just vital.
The other thing is that a lot of people in New York aren't necessarily from New York, so they kind of find networking community and other parents who are in similar situations.
For
So
sure.
I find that to be really, it's a powerful tool in New York where you might not have the extended family. You can kind of
That's
create your
exactly
own
right.
family of
Yeah.
friends.
They're away from their families of origin,
Yeah,
so they
exactly.
don't have that built-in level of support, right? They can't just run
Hmm.
upstairs and drop the baby up with grandma,
Yeah, exactly.
or run down the hall and leave the baby with aunts and uncles, usually. And so that creates another need, I think, to line up that support, to kind of build that network.
Mhm.
And you can certainly do it again after the baby arrives, but if you can start to build that network early on, I think you're in a good position.
Mhm. Now,
Um,
go ahead. I'm sorry.
no, go ahead.
Oh no, I was curious. What in your job, do you work with specific parents from before birth, or do you see them after?
Yeah, so as a psychotherapist, I work with folks from pregnancy on up through the tween years
Mm. Oh
with their
wow.
kids.
Hmm.
So a real range. I think that some folks too, if they've had any issues with depression or anxiety in the past, oftentimes if they're on medication, they go off their medication for pregnancy,
Hmm.
which can create a potential for relapse.
Mm.
I think too, yeah, and so that's kind of the therapy realm is really about focusing on parents and having them get themselves in good working order.
Mm.
Um, the coaching aspect is really much more about my child is tantruming and I don't know how to handle it,
Hmm.
or I think oftentimes we don't want to parent the way we were parented,
Mm.
so
Interesting.
people don't have that North Star. They know what not to do, but they don't really know what to do.
Hmm.
So the coaching aspect is that I offer is really about how do you come to a situation and feel confident and competent about
Hmm.
how to parent in a way that they're going to be proud about.
Hmm.
When
Interesting.
you're stressed, when you're tired, when your back is up against the wall, when you just feel like you're at your wits' end, we revert to what we know,
Yeah, exactly.
which tends to be how we were parented. And again, if that's something you want to change or shift out of, or you need to kind of think about how do I really want to handle these situations, knowing that the stressor points are going to come
Mm.
pretty much every day with kids.
Yeah. Now you alluded to this a little bit, but how during the pandemic and with this additional layer of isolation, how have you seen differences in the way parents are experiencing the early days of parenthood?
I think they feel really torn about how much help to get in. I've worked with folks that they haven't had the grandparents see their babies
Mm.
since the pandemic started,
Hmm.
and that's created a real a lot of heartbreak
Yeah.
for both for grandparents and for the parents. And so that's been a major issue. Work stressors. I think people that are trying to work from home with a baby in the home, and they don't have the child care, they don't have the nannies or babysitters or family
Hmm.
help.
Hmm.
That's a real challenge, a real struggle for people.
Mm.
Again, unanticipated because I think upon getting pregnant, they probably thought, well, I'll just line up to help.
Mm.
This won't be such a problem, and lo and behold, it is. It's really, I think it's a struggle and a challenge for a lot of parents. Um,
Are there any kind of like advice you would have for parents in that situation, or just ways to make it a little bit easier or a little more structured?
well, I really focus on self-care,
Mm.
and I think that tends to go out the window, when a baby arrives, just in general. And I think it's just doubly important right now.
Hmm.
So what does that look like? And maybe when I work with clients at first, I really brass tacks. Are you drinking enough water? Are you
Mm.
eating regularly? Are you getting showered every day and dressed?
Hmm.
Are you getting outside for some fresh air, some sunshine? Are you doing something that's just for you? Are you having fun? And again, this is all kind of like writ small, right? This is not jumping on a plane and going someplace fun and exotic. It
Yeah.
has to be, but small things often. What can you do to make yourself feel good, knowing that parents, particularly in the early stages, are giving of themselves, all day long and all night long.
I always find sleep to be the big kind of tip off. Like,
Sleep is huge.
yeah, yeah.
Sleep is huge. And I always ask about sleep, how much sleep are you getting? Because very often, as you say, if you're not sleeping well, everything is harder.
Yeah, yeah.
Everything. And show me a new parent that's sleeping well. They're just not.
Yeah.
And so how do you make sure that you are, getting naps if you can? I hear from a lot of folks, well, I can't nap. My brain is just, going. And I say, well, at least lie down, rest. If you can't nod off, at least, physically, get some rest.
Yeah.
Other tools they can use, really simple things like meditation. It doesn't
Mm-hmm.
need to be, sitting on a pillow in the dark for 20 minutes. You can meditate while you're washing the dishes,
Mm-hmm.
focusing on your breath, doing body scans, different ways to come back to the present. I think that,
Mm-hmm.
as you alluded to, we tend to be very future focused. We're 10 steps ahead. We kind of, again, that New York City personality, hard charging, which I think can serve you in some realms, but certainly as a parent, I think it backfires.
Mm-hmm.
So I think that how do you come back to the present? How do you stay focused on the here and the now, knowing that, worrying about things that probably are not going to happen, I think creates a lot of heartache and a lot of upset.
And do you have any advice, I mean, for parents who have partners, how to maybe lean on them a bit or work as a team? Because sometimes it's very hard it's a hard role for the non-birth parent to figure out their job and their role.
Yeah, of
as
course.
well.
I think a lot of non-birth parents feel like they're kind of shunted aside.
Mm-hmm.
There's a special circle, with the birthing parent and the baby, and they feel kind of extraneous, or they feel helpless to do anything to support, their partner, because they feel like, well, they're suffering and I don't know what to do. I'm doing my best, and by and large, at least in my experience, I find that those partners are also stressed. They're also going through their own stuff, adjusting to parenthood, and lo and behold, now they're expected to take care of their partner who's also suffering and struggling, and it just becomes a big burden. So I would say daily or nightly check-ins, just to kind of look each other in the eye, say, how's it going? How are you doing? How can I help? And I think once that level of help is a two-way street, and people feel oftentimes, I think, bad about asking for help. They feel, again, they shouldn't have to. I should just do this all by myself. I should be able to handle this. And the idea with the nightly check-ins or the daily check-ins is to let the other person know that, I'm here for you. You're not alone. You don't have to handle this all on your own. And again, I'm here to help. But that kind of ships in the night situation that I think a lot of new parents find themselves in, I think also creates distress. And so how do you mitigate that? I think it's by checking in, making sure you are taking time for each other, which is a challenge. Don't get me wrong. These are not necessarily easy things to accomplish, but I think they're very worthwhile.
Yeah, I think that's a great point. I mean, one thing I always try to emphasize with parents, especially when we're talking about feeding in the beginning, is this concept of sustainability. Like, you may be doing stuff in the moment just to make sure that your baby's okay, but if you're not taking the time to rest, it might last for a few days where you feel like you're feeding the baby as frequently as you need to, but it's not something that you could sustain over time. And so it's really important to, as much as you can, even with your partner, maybe once a day, take a step back and say, is what we're doing now sustainable for a while, or do we have to be mindful about adjusting it to something that is going to be healthy for the baby and for us as well? So I always feel like that's a good way to look at it.
It's a very valid point. I think feeding has to work for both partners, for both parties, and for baby and for parent.
Yeah, and sleep too. Yeah,
sleep for sure. And I think a lot of people, again, give themselves kind of short themselves on sleep, thinking that I need to be a super parent and I can't let my child down. My child needs me to be there 24/7. Whereas I disagree. I think your child needs you to feel good. And if you feel good as a parent, you'll be a better parent, as opposed to if you are, and people can white knuckle it for a while. They can kind of push through for a while, but eventually they hit a wall, unfortunately, at least very often in my experience. And so, how do you avoid hitting that wall, or what do you do when you do hit the wall? I think is, I always double down on the self-care aspect and making sure that, again, are you getting enough sleep? Are you taking care of yourself? Just because I think that is so critically important. And that, like I said, that's the base of the pyramid, right? Sleep, nutrition, just exercise if they can pull it off, if they're clear to do it. But that oftentimes, again, does not happen, at least enough.
I was wondering, we talked to kids during especially the pandemic about creating structure in the day, whether it's a movement break here or something that's almost a ritual just to keep some sense of organization to the day. I was wondering if that might be something that's helpful for new parents, just because there's so much chaos and the days just seem to go into each other. either setting up a call with a grandparent at a specific time or a yoga break at a specific time. But the idea of creating a ritual in your day, which will allow you to frame the day so you don't get lost in the in kind of the timeless feeling of the early days of parenthood.
Yeah, I think as long as you're not terribly rigid about when that actually happens. I think, if I know that, because I think, oftentimes, folks that I work with have a hard time making appointments because they feel like, well, I don't know when I'm going to feed the baby. Baby's not on a schedule quite yet. And they feel like, well, what happens if I need to go? In other words, things aren't quite set. So I think you're absolutely right, making sure that there's, Mom, I'm going to call you sometime, in the next hour or so. Having it be a little bit flexible.
Yeah. Exactly.
And I do plan to do yoga. I'm going to do yoga this afternoon. In the range of between 1 and 3, wherever I can work it out. And I remember I had my daughter, and then I had twins, so I had 3 under 3 for a while, and figuring out how to manage that myself, and knowing that I think scheduling things was key, but also keeping things pretty flexible, and knowing that you're going to get interrupted. I would start prepping dinner, started to chop up stuff in the mornings, knowing that I was going to get interrupted 100 times.
Yeah, exactly.
But being okay with that, taking ownership of that, and knowing that, okay, what can I do about that?
Yeah, exactly. And kind of like you're saying, knowing that there's no scorecard. If you don't do something right, that's okay. It's I think you really need to cut yourself some slack as a new parent and realize
well, and they say, comparison is the thief of joy. And I think a lot of parents are comparing themselves to the person down the block that's all coiffed and perfectly made up or what have you, and pushing the stroller down the block. And, how are they able to do that? And I'm not. What's wrong with me? I'm failing.
Yeah.
And so that just initially is just a terrible feeling to sit with. And I don't think it's accurate,
Yeah,
and I think that,
totally agree.
you as a doctor can point to, and I do this all the time, let's look at the baby. How's the baby doing? Are they healthy? Are they thriving? Well, that's because of you.
Yeah.
That does not happen in a vacuum.
Exactly.
It doesn't happen by itself, and taking a moment to kind of pat yourself on the back and know that this is hard work. This is a full-time job.
Exactly.
And it's thankless, at least for a while. Your kid's not going to thank you for quite some time. But how do you, take measures so that you don't get lost in the shuffle, that you don't feel like you're completely spent. There's just nothing left in the tank.
Yeah, so many times I just want to hug the parent and say, you're doing a great job. I mean, you know what? You're focused.
Well,
you might not be focusing on everything, but you're just doing a great job.
Well, and I'm glad I hope that you do say that to folks, because I think that they do. They need somebody looking over their shoulder saying that you got this.
Yeah,
you're doing a great job, because there's not really when you're working, there are easy metrics. If I do my job, I do it well.
Exactly.
They're successful metrics, and it's easy to see. When you have a baby, it's not the case anymore. It's much harder to see those metrics, particularly, and to know that you're doing it well, and to feel like, again, for folks that feel like they're always failing, always falling short, they're doing their child a disservice. That's a pretty hard feeling to live with. I just, by and large, don't think it's accurate.
The other thing, which I think you alluded to, is like a lot of people have a game face and they want to appear like everything is going perfectly. But I can tell you, a lot of times after just digging a little bit under the surface, people really let out just exactly what they're going through. And I just implore everyone to just realize that people are really here not to judge how you are as a parent, but rather they're here people who care are here to help you as a parent. So really you try to leave the game face and be humble and realize that people are there to help you, and you should reach out to people who can play that role for you, whether it's professionally or personally.
Absolutely. And I think if you're comparing your insides with the outsides of somebody else, you're not getting the full picture.
Exactly.
You don't have the full story. Yeah. And I also think that a lot of people maybe hesitate to reach out for professional help because they feel like, well, again, I shouldn't need that, or that's for folks that are really struggling, and they should be able to handle this. The shoulds get people in trouble.
Yeah.
I should be able to handle this all by myself, and I shouldn't need the help. But to my way of seeing it, seeking help is the healthiest thing, and it's certainly not a failure. I think it represents real strength.
The other thing is, the earlier you do it, the quicker you can kind of catch something at an early stage, and then you just have a whole new skill set that can help you just push back in the other direction. So
absolutely. I've seen people that they come to me sometimes when they've got toddlers or 3-year-olds or 4-year-olds saying, I never felt good after giving birth. And I think that's a real tragedy, because to me that indicates a lot of needless suffering, They did not have to suffer this long. I think, and everyone I worked with has gotten better. There's certainly help out there, and you don't need to struggle, or suffer needlessly. It doesn't mean that somehow you're failing, because you do need help. Again, I think I see quite the opposite. I think that's being really strong, knowing that you need to call upon other folks to help you out. I mean, it's a season for giving and a season for receiving. And when you have a child, that's your season to receive.
Yeah. It's wonderful. I think there's such pearls, and I hope parents, as they view this, can really take it in and take it and use this type of advice, because I think it's great. One book I always like to recommend is the American Academy of Pediatrics book, which is just Heading Home with Your Newborn, From Birth to Reality. It's just a nice book to have on your shelf. I remember when we had our first child, it has all those, in a non-stressful way, it lays out all the information that you kind of need, like how warm should the room be, questions like that. So it's nice to have that on your shelf, just late at night. Any other things? Any last words you want to share? And again, this has been wonderful.
Well, I mean, I think that people, if you are struggling, if you're having a hard time, don't hesitate to reach out.
Yeah.
Whether you work with me or with somebody else, in the mental health field, I don't think there's any shame in that. I think that it can be really beneficial. And I offer parents, free phone consultation if people just want to talk and see, if we're a good fit, or they want some questions answered, that's fine.
And similarly,
I'm
sorry. Our practice, we screen for any postpartum anxiety or depression at every single visit. We've in-serviced our doctors how to recognize it. And again, we have resources, social workers and therapists who come to the office and at a discounted price help parents as well, so we could remove any hurdles to therapy that parents might need. So whether it's at our practice or if you're with a different practice, you should be able to lean on your pediatrician for resources as well. So anyway, Olivia, thanks so much, and I appreciate it, and I enjoy working with you so much.
Thank you, John. Take care.
Okay, bye.
Bye.